case study organ, okay, and you have to hold the heart in anatomical position. Open the right side. Right atrium, tricuspid valve, and as you go up, this is the left ventricular outflow and you can see that there is a VSD. Okay, there is a VSD here. You will see it for better from the left side. Okay,
left it.
this is from the right side. This is the left atrium. You can see that there is an aneurysm or sac-like formation in the anterior leaflet of the mitral valve, and as you go and open the outflow tract, you can better appreciate the VSD just below the aortic origin of aorta. It is communicating, okay, with the right ventricle, and you can see that there is infective endocarditis. There are vegetations. These are the vegetations which is encroaching into the anterior leaflet of mitral valve and has caused its destruction of substance and aneurysm formation.
The white, which one is the vegetation?
Irregular patches. Actually, to start with, they are fiable. Then because of handling and this specimen is quite old, so part of the vegetation you will not see. But you can see that irregularity in the surface. Okay, and then this anterior leaflet is also abnormal. So under surface is showing presence of vegetation. Okay. So essentially, this patient had a VSD. And there is vegetation involving the atrium and near the orifice of the VSD also you can see that there is a vegetation. Okay. Now this is the spleen. You can see that there is a puckered area, and corresponding to the puckered area there is a small area of infarction. Sometimes if it is infected, and there can be abscess formation also in infective endocarditis. Okay. Lungs as such are feeling subcrepitant. Crepitant मतलब उसके अंदर air है. If it has a spongy kind of feel. But if there is some consolidation or some accumulation occurs within the alveolar space, it becomes less spongy and subcrepitant. As such, I can't see any bronchopneumonic focus. Neither there is an abscess. Okay, and in the liver you can see that there is a mottled kind of appearance, like the way you see in nutmeg liver. Okay, in kidneys में तो infarct है नहीं. Again you can get an infarct. Okay, so basically this is a case of infective endocarditis that must have been discussed. Okay, infective endocarditis on a pre-existing abnormality, that is ventricular septal defect. Okay. Hold the heart in anatomical position. The pericardial surface appears shaggy, and the parietal pericardium is adherent with the visceral pericardium. And you open the right side. This is the right side. This is the right ventricle. This is the pulmonary artery, and this is the left side. You see left atrium is dilated in mitral position. There is a tilted disc kind of metallic valve. Okay, the left ventricular inflow is simplified because the papillary muscles have been taken out due to surgical reasons. Okay, and the aortic valve is normal. Aorta is showing atherosclerosis, fatty streaks. Okay.
कुछ भी नहीं है.
This is again a heart. You have to hold it in anatomical position. Open the right side. There is a big ASD, interatrial septal defect. Okay, and this is a tricuspid valve. Right ventricle is also thick. Okay, and there is a subvalvular stenosis. The pulmonary valve is also dysplastic. The pulmonary artery is small. Okay, so this area is narrowed. Okay, and in the left side, area, and if you pass a probe through it, it is coming onto the right side. There is a small VSD. If you see from the left side, then you can make out this is the left atrium. This is the mitral valve, which has been partly taken out because sections have been taken. Okay, and this is the cast of the aortic valve, and just below the aortic orifice there is a small opening of VSD. Okay,
ऊपर है नीचे
इसमें ना if you pass a probe, it's coming from the right side. Okay, so there is a small VSD, there is a big ASD, there is a small VSD, there is right ventricular hypertrophy. What are the components of Fallot's tetralogy? Yes, there will be a VSD, there will be a pulmonary stenosis. Either in the pulmonary valve will be dysplastic or there can be subpulmonic stenosis. The right ventricle is hypertrophied and aorta will be overriding. Okay. Hold the heart in normal anatomical position. Look for any pericardial abnormality. Open the right side. Right side is unremarkable. Right ventricle. This is the pulmonary artery. Okay. And this is the left side, left atrium. The anterior leaflet of mitral valve is okay, but the problem is there with the aortic valve. Okay, there is a vegetation and it has caused perforation. Okay, then you have to hear perforation of the valve first. Okay, and you have to decide whether now it is very difficult, whether it was to start with, whether it was a bicuspid valve or a tricuspid valve. Okay, now it is very difficult to decide, but if you can decide, it will be sometimes possible by examining whether there are 2 commissures or there are 3 commissures. In case of tricuspid valve, you will see 3 commissures. Whereas in case of bicuspid valve, there will be 2 commissures. Here I cannot really decide right now. Okay, and aorta shows atherosclerotic plaques. Big heart, pericardium is unremarkable, right atrium is dilated, and there is a very big ASD, interatrial septal defect. Okay, and this is the tricuspid valve leaflets are okay, right ventricle is dilated, the pulmonary artery is normal as such, left atrium is unremarkable. Okay, and mitral valve is thickened. Okay, chordae are also shortened. Okay, so there is a condition where you get interatrial septal defect with mitral stenosis, and the condition is known as Lutem-Bechet syndrome. Okay, so this is a case of Lutem-Bechet syndrome. Again, this is to show you left atrial enlargement. Mitral valve is showing thickening, caudal shortening and retraction. Okay, the aortic valve is reasonably all right. Section has been taken from here. This is the right side. what is there? The small hearts I will show next time. Next practical. Again, this is, you can see the left atrium is mildly dilated and mitral valve is thick. The chordae are thickened, they are shortened, okay, they are fibrosed. You can see the chordae are adherent, and the aortic valve is also showing involvement, okay. There is irregularity of the castes are retracted. So there is my involvement of both the valves in rheumatic heart disease, okay. I think I will call the next batch then. You can go.